The latest survey from Pew Research Center shows there's still a number of Americans expressing hesitation toward getting the COVID-19 vaccine. Nearly 40% of respondents say they would definitely or probably not get the vaccine, compared to 60% who said they would. Hesitancy is even being seen by those on the front line in the fight against the virus. According to a survey from Howard University Hospital, of 350 workers surveyed, 70% said they did not want to take the vaccine or did not want it as soon as it became available. For more, let's bring in Anita Jenkins, CEO of Howard University Hospital. She received the COVID-19 vaccine earlier this month in hopes of encouraging her staff to get the shot. Thank you for joining us, Anita. In the Pew survey that I mentioned, the numbers for African Americans were the highest as far as hesitancy toward getting the vaccine. What are you experiencing at Howard Medical?
Absolutely. And when we received that data that said our team was hesitant to get that vaccine, I wasn't surprised. We certainly have healthcare disparities, even among healthcare workers. We certainly have our history of the Tuskegee experiments and more, telling us that, you know what, we might not want to trust this as much as other people trust it. And so we were up against those very same thinkings, even in a COVID environment, even in a hospital.
How do you address it?
So as soon as we got that little bit of survey back, we started having town halls, we started having a meeting with our leaders, and then we started putting out facts about the vaccine and facts about COVID every day. So we had FAQs and then the answers. And then I personally said, and of course I had the help of our infectious disease physicians to give the right answers. I said, email me personally and I'll write you back. And I got very good questions. I'm nursing. Should I take the vaccine? I'm this age. Should I take the vaccine? And so we started just informing the team more and more and more. So on the 15th, I got my vaccine. I was first because while I was telling them, you know, here's the information, here's the facts, let's debunk this myth. They were still afraid. And then I said, well, if you take it, I'll take it. And I said, I'll absolutely take it first, if that helps you to be more comfortable. And those that said, I want to wait, I said, then watch me and see what happens.
And Anita, it's great that you did that, and it seemingly worked and encouraged perhaps some of your staff members to take it too. But how worried are you about the population at large who don't have the same level of exposure and interaction with healthcare experts like yourself and people that will lead by example like yourself? Does it worry you that the population at large won't embrace this vaccine?
Absolutely. We've been fighting this fight since February. Well, I came to Howard University Hospital in February, and we've been fighting the fight ever since. And I am concerned that with the resistance to even mask or to social distance or the holidays, and with the resistance, well, this is a hoax, that not enough people will take that vaccine for it to be effective. Not just Americans, but especially African Americans, who are 2 to 3 times more to get it and 2 to 3 times more to die from it. So I'm very concerned about that. And I do believe that it's important for a person like myself and then organizations like ours to tell that story over and over any way that I can to make sure that we address the community and help them see that this is the only way to fight this losing battle we're having with COVID. The world's losing if we don't have a vaccine, and I consider this a very positive event for us to have a vaccine that can cure and kill COVID-19.
What sort of reactions did you get from Howard staff when you did do the vaccine publicly and post it?
So they were very proud of me. They were like, we're real proud of you. And I said, well, you going to take it? Okay, I think so. And then we started seeing more nurses and more techs and more therapists. And our physicians were all in the first place, and then our residents. So it is, it's infectious, if you will. So the more people that take it, the more people trust, the more time that's gone by. It's not yet even been 2 weeks for me. And then I've got a running on our webpage. I think it's our webpage or our hospital Facebook page. I'm saying, okay, it's been 3 days. I'm still doing good. The more they see, the more they understand, the more they know, the more they'll take it. So our rate is increasing every day of our staff and team members that are taking the vaccine. And we need to. We lost staff members to COVID-19, family members of our staff. We have to fight this way. So I'm still trying.
Yeah. Well, Anita, you mentioned at the top something that's very hard to address, which is something that runs very deep, and that is the mistrust in the African-American community toward the medical field. And going back to Tuskegee and that terrible study on syphilis, how do we address something that large and that embedded?
The language that I have been saying is, this is not yet another American attack on African Americans. It's not. This is a pandemic all around the world, and this vaccine is a worldwide cure. And that's the language that I have. And then I have to say, I understand. I get it. There has just been a disparity in healthcare for hundreds of years, really. And then we hear of this physician who was not heard, who was not listened to, and she died from COVID this past week. When you still have these stories of Black healthcare disparity, it is distressing. But I still have to say, this one we believe is a worldwide cure. It's not about African Americans this time. It's about the entire world solving this problem.
Anita Jenkins, thank you for joining us.
Shepard Smith here. Thanks for watching CNBC on YouTube.